At Profiles, we've really been privileged and honored for many years now to have a real expert in a particular topic, which is otoplasty. And a lot of patients, they don't know about what can be done with the ear, whether it can actually be made smaller, how it can be shaped, but they've been bothered for years and years. And many of the patients show up as early as when they were 4 or 5 years old, all the way to 40, 50 years, and they've always been bothered by this. We figured since you're here and we have some time, we'd really broach all the different topics about otoplasty.
Yeah, so otoplasty refers to ear pinning, and it's a procedure we do for people who have prominent ears. And some years ago, I published a textbook really looking at the history of otoplasty, all of the techniques available, and all of the reviews of large studies of these techniques over many, many years, really trying to get an idea of what is the most effective technique, what's going to really create the most natural results for patients that last for the rest of their lifetimes and have the smallest chance for any kind of problems with surgery.
So let's start with some of the more frequently asked questions that people come in with, which number one, I guess, would be just what you just said. What are the procedures, the techniques that we employ in otoplasty? What don't we use? And why don't we use some of the other techniques that are available?
So there are really two main categories of techniques when it comes to otoplasty. One is the cartilage cutting technique, and the other is the cartilage sparing technique. Cartilage cutting technique is a little bit older. It refers to bending the ear into the shape that you want by overcoming some of the natural springiness of the cartilage. And that's done in various ways by essentially weakening the cartilage itself. So a pocket is either made behind the ear or in front of the ear, where the skin is incised, a little pocket is created underneath, and the cartilage itself is either abraded or cut into or shaved in some way in order to overcome the spring and get the ear to bend into the shape that the surgeon wants. We don't prefer that technique, and we'll get into why.
Yeah, so a lot of that is very similar to rhinoplasty, why we don't use a lot of those reductive procedures in rhinoplasty. When you do sort of morselize that cartilage or cut away and weaken it, over time, maybe not initially, but long term, things start to warp, bend, you start seeing edges and corners.
Yeah, cartilage is there for a reason. It's there to provide a natural smooth contour to the ear. And when you cut into that or violate it in some way, you lose control as a surgeon. And results really do have everything to do with control and precision, reliability. And as a problem with that particular technique, you might be the best surgeon in the world, but if you're cutting into the cartilage, you lose control over how it heals. And unfortunately, you'll see patients who've had ear cutting techniques done where years later they may develop very unsightly, unnatural looking ridges or folds in the cartilage that just simply look like they've had a procedure done.
So can those things be fixed once you do get that sort of misplaced cartilage, warpage? Can those things be readily corrected?
They can, to a degree. And so we see a lot of patients who fly in from around the world for revision otoplasty after they had the procedure somewhere else and they have some of these issues that they're dealing with. And you can fix it to an extent. In other words, what you're really left with at that point is not really putting back together cartilage that's been cut or is missing or is misshapen. You're left with really trying to recreate a more natural contour by smoothing over the edges and often by covering the edges with other materials like alloderma fascia to try to take away that unsightly ridging.
So short answer to that question is really, ideally you want to get it done the first time the right way so that you don't have those problems, because while things can be made better, you really can't get back to that normal structure once it's been really deformed. The next question I think a lot of people want to know then is, if we're not doing that sort of procedure, then what techniques do we employ, what things make sense?
So our main favorite procedure for otoplasty in a garden variety ear pinning is using a cartilage sparing technique, which involves sutures to draw the cartilage into the shape we want. So the incision for us goes right behind the ear, right down the natural crease and fold in the back of the ear, such that when you pull the ear back, not even your hairdresser is going to know that there was an incision made there. It hides right in the crease. Through that, we're able to elevate the back of the skin over the ear, and then we use sutures to actually bend the cartilage into the shape we want. What that does is it actually reinforces the shape. It adds some strength by creating a better contour and a little more rigidity to the ear, and we're not going and cutting into the cartilage and causing some potential problems down the road.
So mainly two different types of things that we do. One is really to bend the cartilage into the natural shape, and then the next thing would be to really get the proper setback. And the wonderful thing about using techniques like this is you haven't really cut any bridges. If the first stitch isn't doing what you want, you can take that stitch out and do it again until you get exactly the shape and placement that you want. And I think that's a lot of the success we've had is through that process of knowing how far to bring things and also how not to overdo things.
Yeah, a huge benefit of this particular technique, and really the reason we love it so much, is that you can see exactly what you're going to get during surgery. We don't have to guess. With the other cutting techniques where you're bending the ear over a piece of gauze and hoping it stays that way or hoping it gets the fold you want, you're really kind of leaving it up to chance. With this technique, we can see right on the operating table that we've gotten exactly the right amount of bend to the cartilage, we've drawn the ear in exactly the right amount closer to the head, and that both sides, both ears, are as symmetric and balanced as they can get. And that way there's no guessing. You know exactly what the patient's going to get.